Hi, everybody, and welcome to Becoming a Cat Advocate, how to support your cat at the vet and reduce the stress of vet visits. Because as cat caregivers, we don't like to see our animals stressed. And of course, stress is going to exist at the vets because our kitty friends aren't feeling well. So even when the veterinary staff is doing everything they can to reduce stress, it can be a stressful thing. I don't love going to the doctor because I go there when I hurt. I go there when I'm nauseous. And of course, you could begin to associate those feelings with the hospital like I do. And our cats tend to do that as well. So I'm just going to get started. You guys can put your questions in the Q&A and I'll try to stick around to answer as many as I can. And this is just kind of a brief introduction of how you can advocate for your cat. We're going to talk a little bit about why it's important for your cat to see the vet, because I'm a veterinary technician and a cat behavior consultant. I own Chirrups and Chatter, cat and dog behavior consulting and training. And I am fear-free and low-stress handling certified. And I actually teach that to the general public, shelters, and veterinary clinics. So as you can imagine, advocating for your cat and less stress for your cat at the vet is something that's a pretty big part of my life. So I know it's a big part of yours, which is why you're all here. But there's a common myth that cats don't need to see the vet. My cat stays indoors, so he doesn't have to go to the vet. Guys, I don't travel the world, hopefully soon. I just travel the country, but I still need to go to the doctor, right? That doesn't make me immune to disease processes. So we're going to talk about why it's important for your cat to see the vet, how to advocate for your cat, a little bit about how to help your cat associate the carrier with good feelings and traveling, and some things that you could do to reduce stress at the vet for your kitty. So these are just some cat stats based on some of the studies from the American Animal Health Association, as well as the American Association of Feline Practitioners. And these are kind of staggering stats. As a veterinary technician, I wasn't too surprised to see these, but I was a little surprised to see these. So this was taking place in 2017, 2018, and cats are the #1 pet in the US household. We love our cats, yay. And 50% of those cats do not receive annual wellness exams, so preventative care. And of the 83% of the cats that have been taken to the vet in the first year of ownership, so in many cases, that might be when we first adopt our cat, when we adopt them as kittens, or again, we first get them in our home, over half of those cats never return to the vet. And 58% of cat owners reported that cats hate going to the veterinarian. That's a strong word, but that was the word that was used. And in fact, 38% report just the thought of them taking their cat to the vet causes the human stress. And I care about humans and animals. And a big reason why many cats aren't going to the vet, of course, there's some financial constraints and accessibility to veterinary care. That's a whole nother conversation, because that is a very real problem. But a really big part is the stress associated with traveling and going to the vet. A lot of caregivers have difficulty even getting their cat in the carrier from a safety standpoint, and the amount of stress that they see their cat in causes them stress. So thankfully, that's a large amount of people, but thankfully there's a lot you can do as a cat caregiver to make the whole traveling carrier less stressful for not only your cat, but for you as well. So as you guys can imagine, we have some room to improve. We're always improving and getting better, right? So 9.6% of cats owned in the US will never see a vet. 27% based on these study findings, which was a very large amount of people and cats, which is a wonderful study. 27% will only see a vet when they're sick. And when we use the word sick, when the client recognizes the cat's sick, right? That's very different than me as a veterinary technician identifying that that cat isn't feeling well. 81% of cat owners believe their cats are self-sufficient. So what that means is, I can leave for 5 days and just leave them with a bowl of food. That is not true. That is not okay. Or like I mentioned, that common myth, my cat is they saw a vet when they were first adopted and they never need to go to the vet again. They feel like they're just self-sufficient in a way. 21% of cat owners cannot afford the vet visit. So again, that is a very real problem. And it's something that I know I and the veterinary field is working on to help provide more accessible care in veterinary deserts and areas like that. 4.15% say it's too hard to transport. So again, just the traveling is not allowing these cats to see the vet. And this really gets me. Vet visits keep falling. So cats are the most popular pet. We love cats in America. Yet every year, and this is a little devastating to me as a behavior consultant and vet tech, we're seeing them at the vet less and less and less. So as you can imagine, that's very concerning. And here's a few reasons why. So it's really important for mental and physical needs to be met. And as a behavior consultant, I see quite a lot of behavior issues, from house soiling to aggression towards humans and other cats, being either caused or their medical issue is contributing to that behavior issue. So if you have chronic pain as a human, life is harder. This is true for our cat friends too. If you hurt when people touch you, but no one recognizes that, and the only thing to make the hurt stop is if I bite, that can result in aggression. So from a behavior consult standpoint, and a vet tech, I'm always working with the vet and the caregiver to help address and rule out manage medical issues, because I see underlying medical issues causing the chief behavior complaint in more than 50% of my cat cases. So it's a very common thing. And here's some more stats. Yay, we love stats. Between 50 and 90% of cats older than 4, read that again, 50 and 90% suffer from some form of dental disease, whether that's stomatitis, which is inflammation of the gums, tooth resorption, or periodontal disease, all which are horribly painful. If any of you have had a toothache, and this is the pain that gets missed quite a lot, because understandably, you should not be assessing your cat's mouth every month and like checking their mouth out. I totally understand that is not a normal thing. So it can be really hard to tell unless the cat goes to the vet and they happen to check their mouth during their thorough exam that cat has these common issues. Another thing is degenerative joint disease, also known as feline arthritis, is extremely chronic or extremely common. It's a chronic, painful disease in cats, with as many as 92% of all cats showing some sign of this disease. So degenerative joint disease and arthritis is something I see in my cases contributing to house soiling a lot. And as you can imagine, I want to address that cat's mental needs, make a appropriate litter box setup, work on all that, while also working with the veterinarian to manage their pain and keep that cat comfortable. So again, medical issues can be causing or contributing to behavior issues. And of course, we don't want our cats hurting or in pain. And annual vet visits are vital in keeping your cats happy and healthy. So this is something that's commonly known, but cats are masters of hiding pain and illness. Cats are prey and predator animals. So from their perspective, you have to realize if they are limping or showing pain in a way that a client may recognize, not a veterinary professional, because again, I always say, I don't know anything about cars. I can't even change my own oil. And I don't expect a cat caregiver to understand how pain looks in a cat. And that's where my job as a veterinary technician is to help you understand what that is. So in many cases, by the time the caregiver recognizes there are some behavior changes, so subtle changes can mean big problems. So by subtle, let's say your cat greets you at the door every day and then doesn't all of a sudden, that is a huge behavior change to me. And I'm concerned. What's going on? But usually what we notice is the cat's withdrawn, the cat's not eating, the cat's severely lethargic. So by the time we recognize that our cats are sick, they are very, very, very sick, which is why, again, annual vet visits are so important, so we can catch those things earlier, because preventative care is better than reactive care. because then the sooner we find the issues, the sooner we can manage and help your cat feel more comfortable. But also that means the sooner we can start to address the disease process and prevent, for example, an ER visit because your cat crashed because no one was aware of that disease process. Similar to humans, right? General care is important because yes, I can go to the ER when I'm having horrible cramps, twice a year. And that's thousands of dollars. But ideally, if I went to a doctor regularly and get those things checked up and worked up ahead of time, we won't be going into a crisis, right? So when it comes to annual vet visits, you actually save money. It reduces your vet bills because we can manage and address those issues sooner before we're in crisis mode. And crisis mode, it's still important to get your cat to the vet, but understandably, that is going to be more costly, right? And again, cats are prey and predator animals. So if they show pain, from their perspective, the predators can attack them. So a limp or, again, they may be a little not resting in their favorite places, which to me is a huge thing, but that's something that we might not notice right away. Also, cats are fearful at the vet. So when it comes to fight or flight, pain perception is decreased. So even though your vet is amazing, between prey and predator and flight or fight, it can be really difficult to adequately assess your cat's pain, which is why those annual vet visits, noting those subtle behavior changes and developing a close relationship with your vet while your cat is still healthy is really important. Because, for example, if I only see the vet when my cat is horribly ill, we're still going to do diagnostics to rule out and figure out what's going on, just like in human medicine. But if that vet has baseline blood work and understands what your cat's normals are, that is going to be very helpful in getting an adequate diagnosis sooner. And again, that adequate diagnosis sooner results in less money. So we're actually saving money. And then, of course, cats age more rapidly than humans, and your cat may be overweight, which I know there's a lot of funny memes about chubby cats, but when it comes to cats who are overweight, they are more inclined to have issues with their mobility and other things. So again, we want to kind of get those taken care of right away. But we have some hurdles. We talked a little bit about those hurdles in the beginning. Access to veterinary care, being able to get to the vet. The biggest one, traveling, placing your cat in a carrier. So how can we jump over those hurdles? We're going to talk a little bit about how we can do that as cat caregivers. So reducing stress at the vet starts at home. So many cats, because of the stress associated with the carrier or the travel or both, they arrive at the veterinary clinic over threshold. And what I mean by when I say over threshold, they're pretty severely stressed. They can't think or focus, similar to a human, right? They're pretty scared. And as you can imagine, with them being so fearful, it's more difficult for us to adequately get their diagnostics safely and low stress, of course, but then also their diagnostics, sometimes temperatures, blood pressures, things like that can be inaccurate due to stress. So there's a lot of reasons why we want to prevent stress in our kitties. But thankfully, there's a lot you guys can do at home. And these are just a few things that we'll get a little bit more into. But of course, advocating for your cat, choosing the right carrier for your cat and carrier training, because the same carrier does not fit all. This is very true. The amount of cats I see in carriers that are not an appropriate size for them. And that's the main underlying reason why they don't like being in the carrier. So literally, I just help the client find an appropriate size carrier. And now that the cat can move and doesn't feel claustrophobic, their stress is decreased severely. And that's a very easy thing we can all do. Happy car rides, which I'll talk a little bit about. Bringing your cat's favorite treat or their favorite bed, and then doing what you can to decrease fear and stress for your cat, which is a lot of these things, but we're going to get a little bit more into each of these. This is not, by the way, how it should look when you're getting your cat into the carrier. This is Simon's cat. They joke about it, but we don't want it to be this way. So being a Catvocate, advocating for your cat, some things that you can do as a cat caregiver, not only to reduce stress, but also to help your veterinary staff identify what's going on with your cat quicker, because it's a team effort, right? You know your cat, you see your cat in their natural environment, their home, you know what their normal behaviors are. Make notes of that. Learn your cat's normal and pay attention to changes and share that with your vet. Be prepared with questions and concerns. Because let's be honest, even me, when my cat was recently in the ER, unfortunately, and I'm a vet tech and I'm a behavior consultant, and your brain doesn't work because you're so worried about your cat that it just stops working. So even with my background, I have a folder with all my animals' blood work and past diagnostics and past diagnoses and all of that stuff, and their meds and what milligram meds they are on, which you're like, Tabitha, you should remember that. But when your cat's in ER, it's really hard to think or focus. So you being prepared with concerns or questions and your cat's symptoms is going to be really helpful. So for example, we'll ask you, like, have you noticed your cat vomiting, right? And you might say, I think so, which is still helpful. But if you notice your cat vomits, even if it's a hairball, make a mental note, or even better, keep a journal. Track it. What's the frequency of that vomiting? Because that is very helpful, right? Is it 3 times a week? Is your cat having loose stool 5 times a week? And then as the doctor makes changes to help your cat, we can also observe, is it getting better versus I think they're better? That we really need data when it comes to behavior, but also treating medical conditions. So bring questions, bring your concerns, identify your cat's changes in their daily habits. And then again, especially with some of my senior cats, because I understand not everyone's going to do this, but it can be really helpful to track appetite, vomiting, bowel movements, things like that. There's something called a Purina fecal score. You can all Google it. And it's literally their feces, and you point to which one your cat has. I have my behavior clients do this, and I cannot begin to tell you how many cats had chronic, painful constipation, and it was accidentally missed, understandably. So all I did was have them look at their cat's poop, gave them a chart to look at and say which one it was, and they could share that with their vet. And then we got that cat back in the box, but also we got their discomfort treated. It's important to remember that changes in your cat's daily habits should not be contributed to aging, because age is not a disease. Of course, as your cat ages, they're more likely to be suffering from other pain and other medical issues. But sometimes I'll see someone and they'll be like, oh yeah, she doesn't play anymore, she's older. And I'm like, guys, I'm going to be playing when I'm 70. It might look different, but not playing is a pretty big sign that whether it's stress or pain or some other underlying medical issue, that's a pretty big sign that something is wrong, not just that cat is getting older. Because if they hurt too much to play, we want to help them not hurt, right? And then every vet exam should include 2 to 3 short videos of your cat's acting normal. Because again, vets and veterinary staff can't see your cat in their natural home. And many cats have fear associated with the vet, so they freeze or they're in fight or flight. So it's harder for us to assess their normal behaviors. So take a video of them. I always have my clients take a video of your cat walking up and down for 2 minutes, eating and playing. We all have cell phones. Yay. We all love sharing videos of our cats. Just take a few videos and share that with the veterinary staff. I can't tell you how many abnormal walks I see that this, understandably, your vet shouldn't have your cat walk up and down the hallway because of the fear and stress associated with that. But many cats' gaits are very abnormal and are telling us things. And once I point it out to the caregiver, they see it. But before that, they don't see it. And then the vet never sees it. So those videos are such an easy, helpful way for you to advocate for your cat friends. Other ways we can advocate for your cat. If your cat has pain or any other underlying medical issue, share this with your veterinary professional team before they touch your cat. Share your cat's triggers. This is an example of something that we use with fear-free certified hospitals. It's a pre-visit questionnaire. As you can see, it's one page. It's a bunch of check boxes. So it's not some super in-depth, hey, write me paragraphs, but it says, check any below that your cat doesn't like. How would you describe your pet around other people? What's your pet's favorite toy? During travel to the veterinary hospital, does your pet hide, vomit, drool, urinate, defecate? We get this prior to the cat coming in. And if we know a lot of signs that indicate this is difficult for the cat, we understand that it's also difficult for the owner. And I can give them a call and we can talk about some tips right away to decrease the stress associated with the travel, right? And then also you can share your cat's triggers, because again, many times we may not have a relationship with a vet that we go to continuously, or I see a lot of specialists because GPs can't do everything, right? Specialists are important depending on what's going on with your cat, and they may only see my cat once or twice. So I'm going to make them aware my cat, for example, my cat Jelly Bean is missing a front leg. So she has some chronic pain in her back in specific areas. So I make them aware of that ahead of time before they touch my cat, kind of something like that. Or if your cat in the past, you've noted that they get really stressed out with nail trims, tell the veterinary team that, because we're going to be able to use that information. And to be fair, a nail trim is very seldomly a need. It's usually a want, meaning it doesn't need to happen right now. There's no reason to hold down a cat that's screaming. That is not okay for a nail trim. A need is like your cat's vomiting, diarrhea, and we need to get blood work. And we're not going to hold your cat down screaming either. We're going to handle them in a different way, but let us know that stuff. Understand your cat's body language so you can help advocate for them as well. And for example, if your cat has a history, FAS is just fear, anxiety, and stress. Like I work with a lot of caregivers who haven't taken their cats to a vet in a very long time due to the severe, because again, behavior consultant, remember that part, due to the severe trauma associated with past veterinary visits. Like they can't safely get their cat into a carrier. They're amazing caregivers. It's just or their cat has had a terrible experience, whether it was because they felt so horrible or the handling that was done. Again, there's lots of contributing factors. And I work with these clients and we come up with handling plans and we work with their veterinarian. We find a veterinarian that's more comfortable with handling fearful cats because that's a skill. Handling fearful animals is a skill and nobody can do everything, right? So we're going to work with a vet and a veterinary team that's more comfortable with that. We're going to create a handling plan with my help and the veterinarian's help. And the veterinarian will talk to you about pre-visit pharmaceuticals, medications that can be given situationally prior to a vet visit to help decrease stress. Now, we can't just give meds, right? Those meds are important, but we also need to be doing fear-free handling and low stress travel. We can't be like, oh, they're on the meds, let's just throw them in the carrier. We still have to do all these other steps to kind of do our best to create a low stress visit. But if your cat has very traumatic experiences with the vet, share that with your new vet ahead of time. Work with behavior professionals like myself and other veterinarians and make a plan ahead of time to help set up everyone for success. Sedation might be best for your cat at first, and that's okay too, but we're going to come up with a handling plan. And even when it comes to sedation, I want it to be low stress. So don't be afraid to ask for help because it can be scary to go to the vet for a cat. And again, they're going there because they don't feel well a lot. So even when the veterinary staff is great, they can have pretty scary experiences there. So these are just a few signs of we're not getting too much into body language, but understanding how your cat communicates is a huge part of advocating for your cat. So these are some signs of subtle displacement stress. Like if we were going into green to yellow, these are some of those signs. A lot of people miss these signs. And then they're like, the cat got angry out of nowhere. that's very seldom the case, guys. So for example, if you bring your cat into the vet clinic and you place them on the exam table and you notice these, you may say, okay, you're not going to open the cat carrier until the veterinary technician comes in. And the veterinary technician will most likely just get their history, cover the cat carrier up with a towel, and then only take the cat out one time when the vet's there versus taking them in and out if they're showing these signs, right? And then these are signs of defensive and offensive fight mode. So this is what we tend to see in the vet clinic, the fearful. So everything's back. And again, we want to consider these things from a safety standpoint, how we're going to interact with that cat. From my perspective as a vet tech, I'm going to come up with a handling plan and discuss what I'm doing with the client the whole time. So now that you are going to advocate for your cat by doing all those wonderful things, these are kind of some of those steps I mentioned, but we're going to go a little bit more into them. Preventative, right? I know as humans, we're reactive, we're conditioned to be reactive, but teach your cat cooperative care prior to them being sick. So cooperative care just involves training an animal to not only tolerate handling and husbandry, but to be an active, willing participant in those experiences. So for example, I work with a lot of clients in order for us to do cooperative care with their cats, or I have a lot of clients whose cats are on meds and it's difficult to medicate them. So we do medication training, and these things exist. You can start doing medication training prior to your cat being on medication, and it's pretty easy, especially when we're preventative. So these are just things I want to plant in your head. Look into cooperative care. There are things that you could do at home, especially preventatively, even without a trainer, with some of the resources I have and some other wonderful veterinarian professionals, to start to create positive associations with this stuff from the beginning. But here's just an example. So this is my cat Malt. Her consent behavior, so her saying yes, is going to the mat. If she comes off the mat, that's her saying no, and I listen. So again, we've worked on this a lot. And this isn't for emergency vet care, but as you can imagine, when most of their experiences are positive and they play a part, it's easier to handle those other experiences. So she gets something called Adequan injections given to her, and that's what I'm giving her underneath her skin. She just hangs out there, but if she came off, again, we worked on this a lot. Here is a meds. Oh, sorry, that's a loud video, guys. So I say meds. My cat chooses to come get her meds.
Good girl.
I'm using considerate approach. These are just things as I just always do. I say the word meds. I've broken down the steps, pairing each step with a treat. So again, this is more behavior modification, but she comes for meds. Sometimes she's on the counter because that's her station area at like 9 o'clock. And she's like, Mom, time for meds. If I'm like in my office doing a consult or something, it's awesome. So this is something that you guys can start doing. Even if your cat needs meds now, there's things we could do to reduce stress associated with that. So I talked a little bit about a cat-friendly carrier. These are those general guidelines we like to look at. Ideally, of course, there should be an entrance and an exit, but they should have the ability to be taken apart. So this is the Doc and Phoebe cat carrier, which I really love. This is just a classic plastic one. There's a lot of different variations of this, but I can take the screws apart. It has a top loading area and a side door, right? Of course, I'm going to put a soft thing in there. This one is mesh, but again, there's this door and then the door on the top. So it's very easy for them to be taken apart by your veterinary professional, but also from you guys. Size matters. I already touched on that. These are all fairly big carriers, but again, most cats from head to tail, even if they're thin or on the little chunky side, cats are long. Like they are long creatures. And most cat carriers, the cat can't even turn around in. And like I said, people are like, they hate the carrier because of the vet. I'm like, they hate the carrier because they're completely uncomfortable and don't feel safe in it. That's where we're starting. So consider the size, right? Consider your cat and the size of the cat. 1 cat per carrier. This is just a classic guideline, okay? even if your cats are bonded, we don't want them in a carrier together. That's too small of a space. There's safety issues. If the cat does have some anxiety associated with travel, which is very likely, the other cat may generalize that stress and anxiety. So again, 1 cat per carrier is just a fun guideline for everyone to follow. And then of course there should be ventilation and a visual shield. And those are on most to all carriers, but I have to mention it because if I don't, but ideally your cat should be able to easily walk in and out and turn around when it comes to the size of their carrier. We want to make the carrier a positive place. And thankfully, this stuff is getting more common. I'm hearing more caregivers do it. I love it. It makes me so happy. Integrate the carrier into your home. And I don't mean your basement, unless you hang out in your basement a lot. Into your home means, where do you hang out the most? There. Your cats are bonded to you and they want their resources in that area. Sometimes my clients, I'm like, that's so great that you got it out of the garage, because you only take it out of the garage once or twice a year and scary things happen. I understand why your cat hates that thing. So we're going to place it in the living room, or for example, I have 2 in my office because I'm in here a lot, and I'm just going to make it a safe, fun place. So it's not always we take it out of a garage. It has spiders in it. I've seen so many spiders and spider webs in cat carriers. That's another fun thing. Just clean them out. So also when they're in our homes, we tend to clean them out, and it's not even a thing. Like, we don't forget, which is also wonderful. We're going to place toys, catnip, silvervine, things your cat enjoys in there. We're going to place familiar soft bedding. As we all know, there's actual research to support this as well. Cats love fleece. So placing a fleece blanket or a towel in there to make it a comfortable, again, it's just a comfortable or hiding space, which all cats need more hiding spaces. So it also benefits as that. And then you could even reward your cats for going into the carrier and resting in the carrier. So for example, I'm going to have a treat station. It might be a mason jar with treats in it in my living room. And we're not doing a training session. I'm just watching TV and I see my cat goes in there. I'm going to toss him a treat. Why not? Let's reinforce that behavior, because that behavior is more likely to happen when we reinforce it, right? If your cat is already, because in many cases, cats are fearful of the carrier. Ideally, in a perfect world, in kindergarten, we would work on carrier training and form positive associations from the beginning. But in many cases, cats have negative feelings, understandably, based on what we've been talking about the carrier. So if your cat's afraid of the carrier, and for example, you hold it up and your cat runs, that's a very strong fear response. So what I usually like to do is, let's start with a brand new carrier. Let's buy a cat-friendly carrier. Let's just start with the bottom. We're going to take the door and the top off, and we're going to place that in a comfortable living space that you guys are in. And then I might play with my cat or give them treats around it. Because sometimes cats will be comfortable with going right in it, but I think sometimes we jump up a little head. So I'm going to the bottom's out. I'm going to play with my cat with a wand toy, give them treats around it, occasionally in it. And then once I see them comfortably resting in there and feeling there's not a lot of anxiety when they're around or near the carrier, then I might add the lid, for example. Then I may add the door. So we're going to gradually work on those steps. Now, those steps might happen within a week or 2. They may take longer, but we have to work with the cat as an individual and see how they're doing, because everybody's different. Everyone's past experiences are different. It's really important to kind of break it down. But once we break it down into these steps, where we start a point where the cat can be successful and they aren't exhibiting stress, they learn a lot faster, which makes sense. Cat carrier etiquette is what I like to say. So this is where you can advocate for your cat at the vet as well. So ideally, when we are carrying a cat carrier, I wish they didn't have handles, but they do. This is how we hold a cat carrier, like a beautiful gift, like cats are, because this is a roller coaster ride. And so many cats are overweight. And I can't begin to tell you at the vet clinic how many people, like, they walk in. Again, they're not doing it maliciously. They walk in, the cat's maybe a little heavy. It hits their leg once, maybe twice, and then this. That cat has been on a roller coaster ride and hit a bunch of scary loud sounds. And also the risk of the carrier falling apart. I mean, that's a whole nother, all these things apply to safety too. So this is how we carry a carrier. Cats don't like roller coaster rides. When it comes to taking your cat into the veterinary clinic, ideally they should be elevated. So if you're in the lobby, we're gonna place them on a chair. If they're in the exam room, cats like to be high. If the veterinarian professional starts to kind of pull your cat out of the carrier, that's when you can advocate for your cat. You can even start to take the carrier apart before the veterinary professional comes in, because everyone might not be familiar with this, and this is not okay. And shaking a cat out of a carrier is not okay. So you can set that veterinary professional up for success by taking it apart ahead of time, or even saying, oh, we're going to take the carrier apart. Can you take the carrier apart instead of, she doesn't like to be pulled out. Again, we're being professional and kind, but we're advocating for our kitty. And from a veterinary technician standpoint, we like to examine cats a lot in their carrier because it's their safe place, which is why we love taking that top off. So travel, there are, by happy car rides, similar to dogs, let's say your cat's in the carrier, we're gonna just drive them through the Starbucks parking lot. Why doesn't people talk about this with cats? And you might get a pup cup, which is essentially just whipped cream, and your cat gets to lick whipped cream in their carrier. We're not taking them out of their carrier. So again, it's a short drive. You might even just go around the block and come back. So we're starting with short drives because most cats, guys, the only time they're in a car is when they feel like not great, and we're taking them to the vet. So happy car rides, that's what I mean by that. Ideally, we're going to cover the carrier with a feel away infused towel. Because again, when you're stressed out, we want to minimize all that auditory and visual stimuli because that's easier. Feel away is a pheromone that you can spray ahead of time on your car or even on you and the towel. We don't want to spray it while the cat is in the carrier, of course. Play calming music, which you can play classical music. There is an app that I like to use when I travel a lot called the Easy Purr app, because purring is a self-soothing sound for kitties. So I play that when I'm driving in the car to, again, drown out some of those stressful sounds that might be happening. I'm going to cool or warm the car up prior. If it's winter in Ohio, I'm warming my car up before I bring my cat in. And as someone that has heated car seats and will never go back, it does make a difference. Again, little things that we can do that make a big difference. We want to make sure the carrier is properly secured. Ideally, I like to put it in the back seat on the ground because that prevents us from doing, because most cats, that actually escalates their stress when we're poking and talking, versus you're behind the passenger seat, you're stable and you're covered. Or of course you can seatbelt them in. Avoid feeling rushed. If you have 5 appointments that day, maybe don't schedule your vet appointment that day. Because even if you're awesome, when you're rushed, like you don't even realize you're doing it, but you're moving really stressfully and abruptly. And then also notify the vet hospital when you arrive. I do this with so many of my clients, and with the pandemic, thankfully, where a lot of vet clinics are avoiding the whole lobby thing altogether. Because, for example, if the vet clinic is doing the best they can, they may be running late due to emergencies. Thank your veterinarian, please. We're all doing the best we can, but they're in the lobby and then a dog comes in, that cat's going to go over threshold. Can I just keep them in this comfortable environment and have the technician just give me a call when I'm ready to go right into an exam room? Yes, you can, for sure. Bring your cat's favorite bed, brush, treats, and toys. Again, even if your vet is not familiar with fear-free or feline-friendly handling, these are ways you can advocate for your cat. And those veterinary professionals may have never seen these techniques. And then not only are you helping your cat, but you're planting seeds to help reduce stress for other cats, which I love. So this is an example of what I bring. And my veterinarian is wonderful, but I still bring all this stuff. Churru, licky mat, that's a Zoom groom, which is a brush she really likes, squeeze cheese. This is an example, my cat's eating her licky mat prior to the vet coming in. This is my other cat who, yes, I brought her heated cat bed and plugged it in, and we're working on training while the vet is getting things ready for her. So again, it's fun. We're bringing their favorite things. So cute. So some considerations when finding a vet, because if your vet, let's say you have not been comfortable with the way your vet has restrained your cat, it's important to talk to them professionally and kindly, of course, right? Because I call it practicing veterinary medicine because we're always improving. And for example, I was taught to scruff and stretch cats years and years ago as a technician. I haven't done that in over 8 years, but it's important as we learn, right? So that's where you can help work with your veterinarian, share some information, or even say, would you mind can we not scruff my cat? Because again, this is where we're talking about your cat's triggers. She gets more upset when that happens, right? So you're advocating for your cat. You're letting that veterinary professional know that you're not comfortable with your cat being scruffed, but in a very professional way. So some considerations, of course, we want to make sure the office is clean. That sounds like a given, but you'd be surprised. So we want to make sure the office is clean. Ideally, we're going to find a clinic that's doing feline friendly handling or gentle control. And many places we can seek fear-free certified professionals or cat friendly certified professionals or low stress handling certified professionals. And these are 2 websites where you can go that have a lot of great cat resources, but also where you can try to find some of these professionals. But there's a lot of vet clinics who do not have these credentials, who are also wonderful with handling cats. So again, observe how the veterinarian and staff members work with you, because I love your cat, but I should love you too. So how they work with you and how they work with your cat to reduce stress, right? Check on professional accreditations and experience. Do they have registered veterinary technicians on staff? Because that matters. I had to go to school. I had to take boards. There's a lot of skill set that comes along with that. And I want a registered veterinary technician monitoring my cat's anesthesia. And so do you, for lots of different reasons. So asking about how do they keep up with CE? Are they AHA accredited? Again, there's a lot of different ways we can do that. Make an in-person visit to the vet practice ahead of time to check on the location, because you might be like, I thought it was this far away, but and you most likely want it to be within a close vicinity of you, understandably. Make sure it's clean and that the place is organized. And sometimes I even have my clients schedule an appointment. Of course, we have to pay them for their time because veterinary professionals, our time is valuable and limited. So I might have many of my clients, we do an intro visit where we don't bring the cat and we meet the veterinarian and the staff quickly. And then we may even start to talk about a handling plan ahead of time. Because again, a lot of the cats I've worked with have had really severe trauma and haven't seen a vet in a very long time due to safety issues and again, many factors. So make an in-person visit, get to know the vet, find a veterinarian who shares your philosophies about pet care, right? And trust your gut. I know that sounds like a given, but there's a lot of veterinary professionals. I'm a wonderful trainer and a vet tech, but my communication style may not flow well with my client. That's okay. I'm not going to take that personally. I'm going to refer you to another person, right? So it's not that if you don't feel comfortable, it's not that the veterinarian's bad. They may not be a good fit for you and your cat. For example, if you have a really fearful cat, or if you have a cat that has a rare medical disorder, that vet might not be comfortable taking care of that disorder, and you will have a specialist, right? So these are all the things that we need to think about. Establish the kind of care your pet needs. Some veterinarians have rehab on staff. Some veterinarians have an ultrasound, and the veterinarian is certified in the ultrasound and comfortable with doing those. So again, these are all the things we kind of want to consider when finding a veterinarian. So I just want to show you guys some examples of what gentle control looks like, because I think not everyone has heard those terms before. So these are all me, as you can see, but I'll just share a few examples of what it looks like, and I'll describe what I'm doing. So I'm using a lure to move the cat instead of physically manipulating her. And you can see we have a non-slip surface because a cold metal table ain't no reason for that. Ain't no reason for that. So there's a non-slip surface and a towel on there. She's eating from the licky mat. I'm using gentle control, which means I'm not scruffing or using force or stretching her out, right? The veterinary technician applies alcohol onto a gauze instead of drowning her leg in it because alcohol is really aversive. So not everyone's going, again, I'm someone that teaches this for a living, but I just wanted to show you what it looks like. And as you saw, we very gently moved her leg and she's still sternal, which means she's sitting. There's no reason for me to flip a cat in an uncomfortable manner when they're a lot more comfortably, understandably, when they're allowed to sit up, which is a natural position for them, right? And this is how we draw our blood. That's something called a butterfly, which is used in human medicine. And thankfully, we're using it more in veterinary medicine because animals are alive and they move. So butterflies can be helpful in when they're moving and things like that. Syringes can be applicable at other times too. But again, that's why I chose this. Here's another example of me working with a cat. He's an old boy. So I'm using, again, gentle control. I'm using, the way I'm touching him is very, we call it a touch gradient. So I'm starting at a place where he's less sensitive to a place where I start his neck and then go to his rump to feel. I'm approaching from the side.
I love it. Yeah, that's fun.
Oh, sorry, there's so many videos. I'm trying to pause it. Boop. Then there's this is a video. I work with shelters as well. So this is a video of a kitten that I was vaccinating for a foster. And you can see I have everything ahead of time ready. So I have towels, I have everything I need. And I have the foster actually moving a toy. And I'm like, that's not how toys look for cats. They don't go in. And you see the difference in focus with the string toy. So you're going to see I use a touch gradient. So I touch the area ahead of time. So I'm not just like, right? I kind of gradual touch. And I'm assessing the cat's body language the whole time. Yes, the cat is being played with while they get vaccinated. And this is how I vaccinate a lot of kittens and examine a lot of kittens. And then I'm also forming a positive association with vet visits during their key socialization period. But these are just some examples. And people are like, what if my cat's really fearful? I will do these similar techniques. The first cat, the black and white cat, she used to be really fearful at the vet. And I've implemented all of these considered approach, gentle control. And within 3 visits, this is how her vet visits look now. Because I am aware, I may use a towel to restrain as far as a fearful cat. I may examine them in their cat carrier. Again, the veterinarian may prescribe some anti-anxiety meds. We may sedate the cat. There's lots of different options, but the whole 5 people sitting on a cat that's screaming, that's not okay. It's just not. Thankfully, I don't see that, but that's something that's not normal and that's not okay. And then I just wanted to do a quick note on a fear-free return, because as a cat behavior consultant, I see a lot of redirected aggression in cats. And sometimes it's from when one cat comes home from the vet and the client's like, these cats were bonded. They would sleep together. They will allo groom, like lick each other. And then I took my cat to the vet and now they're fearful or one's upset with the other one. So what happens is many cases when a cat goes to the vet, cats communicate via scent, right? So they communicate via scent. If they just smell another cat on a sock, from their perspective, it seems like there's another cat there. So when your cat goes to the vet, even though we're not like rubbing smells on them, there's smells in the environment that cat picks up. So what happens is when we bring that cat back, and let's say we just integrate them, like you just open the carrier up and let your cat go, your other cat may smell that other cat and be like, that don't smell like Norman or whoever. And from the cat's perspective, it's like another cat is there. It's like my husband coming in with a realistic mask. I'm a nice lady, but if some random dude walks into my house, you know, I may react with aggression, right? So from the cat's perspective, they are like, what is going on? So sometimes that can result in these redirected aggression events and actually affect the relationship between your cats. So something I recommend is, let's just assume it might not go well, because that's what I see, and set your pets up for success. So we're going to just control the reintroduction. So for example, anytime my cats go to the vet, they come home. I usually go in this room. I have a lot of rooms. So I go in this room, I open the carrier up, and we just hang out. I allow them to explore and check it out. And again, it might only be a minute or two. It might be 5 minutes. And that's what the safe haven is. And then when I'm opening the door, I am supervising. So I'm assessing body language. So if my one cat starts to, like, we call it the 3-second rule. If a cat comes up to your cat and starts to smell for like 3 to 5 seconds, we're going to redirect with a treat at 3 seconds. We're going to create, it's a party when this cat comes home. We're going to form his new scent, which will dissipate over time with good things to prevent an altercation or a redirected aggression event. So again, it's a small thing that I think is really important, and it may only take a minute or two, but it's important for us to do. Oh, that's Norman. I didn't realize it was a video. He's so cute. That's my cat. So in conclusion, because I know that was a lot, make your vet appointment today. Your cat will thank you. He's so cute. I just love cats. Can you guys tell? And then this is I am here to take some questions. You can follow me at Chirrups and Chatter on Facebook and Instagram. I share quite a few behavior and cat care tips, including cooperative care and fear-free low-stress travel tips. I have handouts available on my website for cat carrier training that are free, along with some other helpful resources. And I have a podcast. Everyone has a podcast. So I'm going to stick around for a few questions here. I'm speaking to a screen. I know you guys are all there though, and I appreciate it. I hope everyone's wonderful. Thank you so much for this. Thank you for the reinforcement. I love reinforcement, you guys. Let's see here. Oh, this is a really good question.